how do people start having that conversation with their partner to say, look, I think that we could benefit from something like this?
That is a great question. Your feelings are absolutely true. And you're not saying that they intend for you to feel that way by framing it in this speech. You are just letting them know what's going on inside of you. Things change with your sexuality and the sexual engagement and the partnered interaction around sexuality over the course of a relationship. There is no correct level of sexual desire. There is no correct level of amount of sexual engagement, and that will vary for every individual. Sex does not just mean intercourse. The idea that it's just because you're horny or you just want it is a stumbling block. You can both want it for a variety of reasons. You have to be having good enough sex. A sexual script is a great thing to have. It's comforting. It's your go-to meal. It's what you reach for, and it keeps you nourished, and it keeps you sustained, and it keeps you going. You should never be ready and willing to be engaging with somebody physically if you're not ready and willing to discuss that engagement with them. Focusing on an orgasm is the worst thing you can do for the possibility of having an orgasm or to the quality of your orgasm.
Welcome back to the Rena Malik MD podcast. I'm your host, Dr. Rena Malik. Today's guest is Dr. Elisabeth Gordon. Dr. Gordon is an integrative sexual health professional who is a psychiatrist and sex therapist. She's also an educator, writer, and thought leader in sexual health. She also has a private practice in New York City that is focused on sexual health. Today, we talked about how to talk to your partner when there is a desire discrepancy, meaning that one partner may want sex more than the other. We also discussed how to introduce the idea of kink in your relationship, if that is something you are interested in, as well as how to talk to your children about sex. We talked about when you should see a sex therapist and what exactly you can expect when you see a sex therapist. And of course, we covered how to have better orgasms. We hope you enjoy. Dr. Gordon, thank you so much for joining us.
I'm so excited to be here.
So I've told you this, but I'm so excited about our conversation because you come at it from such a different lens from anyone else who's trained in sex therapy, because you also went to medical school and had formal medical training. And so I'm so excited to talk about all the things that are related to sex and sex therapy and psychology and psychiatry and how they interplay.
I love working in this field exactly for that reason, because I really think that we need to be able to bring all of it. It is the ultimate biopsychosocial field, and I feel I'm well positioned. There are a few of us in psychiatry and sexual health, but not a ton, and I would really love to see there be room for more.
Yeah, it's so valuable. You know, I think that a lot of couples come to sex therapy or want to come to sex therapy because they're unsatisfied with their relationship for whatever reason. I think the most common being having a desire mismatch, meaning one person having more desire and one person having less. But how do people start having that conversation with their partner to say, look, I think that we could benefit from something like this?
That is a great question. I think that the discrepancy of desire and the distress around it is probably the most common reason why people seek some form of sexual health therapy or treatment. Yet it is so hard. People talk to other sex therapists that I know about how long it took them to get there. And I have done a little bit of education in my own work and in my own social media about trying to help provide some tips for how you can start to broach the topic, because it often simmers for a long time. And the trouble is with that simmering, the trouble is with that distress that happens, is it is shown to have impact on the relationship satisfaction, on your own mental health, on a variety of health parameters that are really important, on the quality of your life. So things that I recommend are to understand what it is you're dissatisfied with, to understand if you are the person who feels that there is not enough sex in your life, or whether you're feeling rejected by your partner because you want more and they don't seem to want it, and try to specify for yourself what it is. Even if you can't, at least start to take some notes. If you're the person on the other side who feels that your partner wants sex all the time and you're feeling pressured, what does that mean to you? How is that distressing to you? even if you take notes on when it is that it's happening or what is going on that you notice, what was the timeline of how it started. And then it can be really hard for people to bring it up to their partners. It means a lot. They worry about what it means for the relationship. Sometimes they worry about hurting their partner. Sometimes they worry about ending the relationship or rocking the boat. But there is so much room for help that it is important to bring it up. And ways that I recommend bringing it up are starting perhaps even by talking about wanting to talk. So taking a step back and talking about, hey, there are so many things that are wonderful about this relationship, but I want to be able to talk to you about some of the things that are difficult. Could we set aside a time to talk about one of these things that's a little bit more difficult? And if you frame it in that positive way, it's like, yeah, it's one of those things I'd like to make better to match the other things that are good about the relationship. And then making sure that you have time, space to have a bit of a conversation. But that doesn't necessarily mean sitting down and looking at each other face to face the way we are doing right now.
Yeah.
It can mean that you go for a walk so that you're side by side, or you go for a drive so that you're sitting side by side and don't need to look at each other if that's more comfortable for you. It can mean sitting down and talking face to face, but it doesn't have to. And bringing up that you are not completely satisfied with the way your sexual interactions are going, and then providing some of the reasons. I also like to provide a lot of framing language around this. Mm-hmm. There is a lot of good research in the psychological realm and in the social science realm about what is effective communication and what is sometimes referred to as fair fighting. Not that this needs to be a fight, but the principles still apply. And effective communication can include that you frame it as I statements, because I statements are non-threatening. You really want to start with, well, I feel this about the situation, or I feel this when this happens, or when you do X, Y, Z. When you frame it with a you statement, when you do this or you did this, that can make somebody feel quite defensive. When you become defensive, you're not as able to hear and process what is being said. So there won't be as much room for a back and forth, for a conversation, for resolution. So framing it with an I statement and starting with how you feel when your partner engages in a specific behavior, and if you can, saying, I would prefer it if you instead were doing XYZ and offer an alternative behavior. But at least beginning with that statement of, I feel this when you do that, is a great way to frame it. And it's also 100% true. Your feelings are absolutely true. And you're not saying that they intend for you to feel that way by framing it in this speech. You are just letting them know what's going on inside of you. And that is extremely important because we don't know where our partners are coming from. Mm-hmm. So much of the problem with desire discrepancy is the lack of communication. Mm-hmm. And that is not anybody's fault. We haven't been taught well in our society how to communicate about it, but you want to start to try to communicate and try to understand where your partner's coming from, what is going on in their head. As much as we think we know our partner or partners, we don't always know them. We don't know necessarily where they're coming from or what is happening for them in this situation. So starting with that allows your partner some insight into what you're feeling. And you can talk, if you are able to access that information, about why you might feel that way or what it means to you. If not, at least saying how you feel about their behavior and working together to say what you would prefer and seeing if there is room for that, if your partner has room for that, but also understanding what's going on for your partner, then leaving room for your partner to respond. How do you feel about it? What's going on for you? What are your thoughts? What is your intention when you're engaging in those behaviors? Might be a nice entree to help them open up and respond.
Yeah, so I have a couple thoughts on that. And I think that is like an ideal framework. And I always say that we don't know how to talk about sex. We weren't taught how to talk about sex. And and it's really important, right? But we have never said or known how to have a conversation or receive a conversation about sex. If my partner said to me, I love our relationship, everything's so great. I mean, we're in a great relationship, but say he had told me very early on, like when we were sort of just getting to know each other, like, hey, I this is so great. These are things are great, but like, I want to talk to you later about what's wrong. It would lead to a lot of catastrophizing, like, oh my God, what is going on? Let's start with that. How can you cushion that when you talk about it to make them not feel like, yo, like, oh my God, our relationship's over. We're going to get a divorce or we're going to get broken up or like something horrible is going to happen.
Exactly the feeling that can happen on both sides. It can keep one partner who wants to say something from saying something. And then when the other partner or partners hear it, they can exactly fall into that catastrophizing and worry about it. I really do emphasize that a great way to talk about it is bring up what is good about the relationship. I love that we're together. I love how we talk about other things. I love that we're able to interact and we're on the same page about X, Y, and Z. But I'd like to talk about one of the areas that we're not interacting as well, and I'd like to make it also one of those areas so that it's not about, oh no, it's terrible. That is another great rule of conversation and conflict resolution, that you don't make all or nothing statements, that you keep it specific. If you are the one bringing it up and you're really worried about that, or if you as a partner hear this from your partner and you're really worried about it, you can say, that does really worry me. I'd like to tackle it now. I don't want to sit here. It is going to bother me if we sit there. Your partner may or may not be ready, but at least if they are leading in, they might have some idea about it. And it is part of the negotiation of when you might want to handle it. And that is the process of learning, that it's not the immediate end when you bring this up. That this is one more thing that has to be worked through. And that is part of the problem, that we don't learn about how to talk about sex. We don't learn about what sex really is. We don't learn that it is a complicated, complex behavior and yet another part of a relationship that you have to navigate and learn. And that is not just a one time. Things change with your sexuality and the sexual engagement and the partnered interaction around sexuality over the course of a relationship. So the more you can start to approach it and start to talk about it, the better chance you have of having a satisfying sex life over the long term.
Yeah. I think the other thing is, even if you use an I statement, let's give an example, right? I feel that when you reject me for sex, it hurts my feelings, and I wish that we would have more sexual encounters, right? Say you said it in those words. The person who is the one doing the rejecting may, in my experience or what patients tell me, is that they may start feeling really self-conscious, or they may start feeling really like, well, I'm just not in the mood. Like, why are we talking about this? Right. And they may immediately shut it out the door. So how can people handle with that?
So this is where education comes in on both sides. It is really extremely important to understand that there is no correct level of sexual desire. There is no correct level of amount of sexual engagement, and that will vary for every individual across the lifespan, even from day to day, week to week. And one of the things that I always tell people who come to see me, and one of the things I've emphasized when I've been approached by media to talk about this, is I tell everybody, is guaranteed that at some point you're going to have discrepancy of desire. It is not guaranteed that it's going to be distressful, but it's guaranteed. And my analogy is that you don't expect to go into a relationship, and just because you're in a relationship, you and your partner or partners always want the same food, the same kind of food, the same dishes of the same kind of cuisine at the same time forevermore. Amen. You don't. You work it out. You navigate. Oh, fine. You want Chinese tonight? Okay, well, I'm really looking forward to Italian. Can we do that on Thursday? And that sexual engagement takes some of that same navigating. There is, I think, a tendency in our culture to pathologize the person with lower desire and to say, well, they just need to step it up. But that is not the case either. There is no innate pathology to wanting to engage sexually more, and there's no innate pathology to want to engage less. The trouble is not the amount you want to engage. The trouble lies in the discrepancy, and more than the discrepancy, the trouble lies in the distress that it causes the individuals involved. And it is extremely important to hear that, to know that, to have it reinforced, and to understand that as the partner who may want more, there is room to get more that may not look exactly what you're thinking of at that moment, but to understand that sexuality is much broader. And as the partner who may want less, there's room to understand that there are ways to engage that might be pleasing to you, that don't include what you don't want to do, but are still pleasing to you and can help and support your partner. So very bluntly, to go through some of the education I think is really missing out of our very paltry sex education.
Yep.
It's to understand that sex does not just mean intercourse. And it means any kind of engagement for the purposes of erotic pleasure. And that it can range from just kissing, just holding and feeling erotic contact with your partner, to one person having an orgasm in a variety of ways while the other person supports them in that or helps them with that manually, orally, not necessarily genitally or anally. And it can involve also just one partner sitting there like, I'm really excited for you to pleasure yourself. I want to be part of that. I want to support you while you do that. That is not available. Helping you with that is not available for me at this time, but I am able to engage in XYZ way. And that brings up that for the partner who feels less desire, it should not immediately be thought of as, if you want more sexual engagement, partner who has more desire, that means I have to be available to have intercourse. Instead, one of the tips and tricks that I try to provide is try to be open. We have to know the difference between what is called responsive desire and spontaneous desire. Spontaneous desire is that feeling that comes at you out of the blue. Oh, I'm really horny. I really just want to go home. I'm really interested in having some form of sex. And that is the desire that we think of in our society. But there's another kind of desire. Responsive desire is not that you start out in a state of desire or a state of arousal, but you are open to that possibility. This is very common in long-term relationships. It's when your partner says, how about some fun time? And you're like, oh, yeah, I guess I could. And then as you engage, you start to feel desire, and then you start to feel arousal. So it's learning the difference between being open to it as opposed to expecting to be ready and raring to go from the outset is one important component. And another thing that I suggest is try to stay positive in your language and offer up what is available, which doesn't mean you always have to be available, because there are times where you have to honor that you are not available. You just do not want to engage in that way. But offering up how you could engage in whatever way is a great possibility. And saying, well, great. I am available to sit and hold you while you self-pleasure. I would love to be there for you while you do that. Or I am available to cuddle tonight. And also, if it is possible, walking through some of the things that are interfering with the possibility of desire. Because there are often so many things. Are you tired? Are you stressed out? Do you have too many chores? Are you feeling financial pressure? Is there family pressure? Are there family members that aren't doing well, or dependents that you have to take care of that can really sap your energy, leaving you feeling that engaging is one more thing you have to take care of? Trying to walk through some of those and then maybe working out between the partners how to mitigate the burdens that are interfering with desire can be helpful. So that's more of a broad talk, and the idea of being open is more of a in the moment on an incident to incident basis. But these are a variety of ways that we have to approach it. How do you talk about it when you first start talking about it? Trying to remain open, understanding some of these important components of what are the realities of sexual engagement that we have missed in our sexual education, spreading the message about this to your friends so that they know it too, and then trying to set up some safeguards to try to support that space for the partners and create room, especially room to then explore responsive desire, understanding responsive desire and exploring responsive desire, but then on an incident to incident basis, trying to approach it and look inside yourself and understand both from the person that has higher desire, what is it that you're seeking out of this encounter right now? Mm-hmm. And what components are dependent on your partner? Is that you just want to have an orgasm so that you can go to sleep? Or is that really dependent on having your partner engage? Or is it that you're seeking some validation and you want some emotional connection? Does it have to be intercourse? Can it be other erotic activities? Could it just be cuddling, maybe talking? And if you're the partner with lower desire, looking inside and seeing what's available to you at that moment and trying to find a balance between these.
When was the last time a doctor spent an hour with you and truly focused on your goals? And when was the last time you left feeling like you really understood what was going on with your body and had a clear plan of what was going to happen next? At my practice, Rena Malik, MD, I aim to do just that. I specialize in sexual dysfunction, bladder health, hormone health, and pelvic pain for all people. And I want to revolutionize how we take care of patients. I want to really get to know each and every one of you. That's why at my practice, when you come to see me, I'm 100% present with you for an entire hour. And after you leave, if you forgot to ask me something or need clarification on something we talked about, don't worry. I'll respond to your issues and questions quickly through our secure messaging portal without any additional costs. Just go to www.renamalikmd.com/appointments and schedule your visit today. We see patients in Irvine and Beverly Hills, California, and virtually for patients from California, Florida, Illinois, Maryland, New York, New Jersey, and Virginia. If you aren't located in these states, consider making an educational visit where we can talk about your conditions generally, but I can't diagnose or treat you. I can't wait to see you. What do you think about gifting sex to your partner?
That's a complicated one. I think that the term gifting sex can encompass such a wide range of behaviors so that it is neither good nor bad. It depends on what it means to the individual. Mm-hmm. And the range I've seen is everything from I feel that my partner wants it. I'm open to it. I'm not really excited about it, but I'm open to it. I know it'll make us feel closer. I'll probably feel good by the end. I'll get into it, which is actually just speaking to that idea of responsive desire.
Yeah, which is normal.
Which is completely normal. To people who have told me that they feel that they need to, on special occasions or as a reward, even when they're not feeling like it, offer themselves up, and then they are completely not into it. It just is something that they're basically offering their body, but their mind is checked out. And that is a recipe for disaster. I won't say that's bad. There's no judgment. Mm-hmm. It's a recipe for long-term disaster in my book because you're not feeling fulfilled. It leads to a distinct possibility of resentment. You are not being present during that activity. And the resentment can happen because you feel obligated. Mm-hmm. So between the sense of obligation and the lack of pleasure, there is a large room for resentment. And resentment is not a great way to conduct satisfying sexual interactions.
Yeah.
Or a really good basis for healthy relationships.
Yeah, I mean, I think that occasionally gifting sex is fine. Like, it's totally fine. It's just a part of, like, you do things for your partner sometimes that you don't want to do, like pick up their underwear off the floor, whatever it is, right? Like, or do their laundry or whatever. And it's okay. Sometimes you don't want to, but not all the time.
Right.
At least that's my thought. And I think in terms of, I've had some friends who've told me, like, my partner expects sex every single day from me because we are married and we have to be together. And that's sort of what the expectation is. And I think that's sort of challenging to navigate because if you don't have desire every single day, like say you do most of the time, that's great. But if you're doing it out of obligation day after day after day, it can sort of get you set up for problems in the long term.
And this is where that communication is so important because all of this is speaking to that idea of gifting sex and sometimes it's okay. Yes, it is. I think another key myth that we need to bust about sexuality, beyond the idea of desire being only spontaneous desire, is that sex in all its forms, using the term sex to mean all sexual engagement, is something that you should only engage in when you really want it. And I can hear the backlash to this statement already. I can hear it already. But what I mean is that to a degree, we don't, as adults, engage in there's a wide variety of behaviors that we don't engage in just because we want to.
Right.
We engage in them also because we understand that they will benefit us in a myriad of ways. Mm-hmm. And sexuality and sexual engagement is no different. The idea that it's just because you're horny or you just want it is a stumbling block. You can both want it for a variety of reasons: to please your partner, to sleep better, to get warm on a cold night. You can also maybe not be so excited about the sexual engagement or be expecting to have as much pleasure yourself, but value that your partner will feel pleasured and value how it supports the relationship. Mm-hmm. And so what are your values? What are your goals around this activity?
Yeah.
Nobody wants to pay their bills. We pay bills. Nor am I saying sex should be just an obligation of going to pay the bills, but there needs to be communication, both internally with yourself and with your partners, about where on that spectrum are you, mm-hmm. and what are the expectations around that, so that you have some room for both engaging for a variety of reasons, or starting with room to engage when you want to, but also room to engage for a variety of reasons, and room to engage because the reasons are not sexual end goals in and of themselves.
Yeah. You know, I think it was interesting you said, like, having sex to support the relationship or support your partner. And I wonder, as you're saying that, like, when people are like, I don't want to have sex because I'm not in the mood or because whatever, I just don't want to. I wonder in terms of like, what is the hesitation? Like, if you have sex to support the relationship or the partner, or just part of like, not obligation, but like feeling like just the things you described, why does that make you feel bad? Right? Like, are we told in media or in society that that's not something you should do?
I think I'm not sure the message is so much a direct negative message of you should not do that, as much as there is you are missing a positive. That, of course, when you go to engage in sex, you should be aroused, you should be excited, you should have crashing simultaneous orgasms, and if you are not, you're doing it incorrectly. Mm-hmm. And the corollary to that idea of leaving room for engaging in a broad variety of reasons is also leaving a lot of room to understand when you really don't want to engage or what your limits are at that moment. But with both of those, honoring them so that it is okay, this is what I'm capable of now, and that's okay. Mm-hmm. That is enough. What is the fundamental guiding principle through this is, are you getting some pleasure out of this in some way? Is it serving you in some positive way? Whether that positive way is pleasing your partner and you feel good about it, feeling physically satisfied yourself, maybe both. If it is not serving you in any way, if it is a negative, if it is at least not a positive, and definitely if it is a negative or begins to become a negative, then we're working into a danger zone. But we don't leave room for the varieties of ways in which this might be self-serving and self-supportive and supportive of the relationship. And I use the term self-serving and self-supportive not in a negative manner, but in a protective manner of providing for yourself and all of your wants and needs. Mm-hmm. We don't leave room for sex to be something that can help in these other ways. Yeah. We have this myth, you have to do it for this amazing physical reaction kind of way.
Yeah, I always say that it's okay for sex to occasionally or very often be mediocre. As long as you are, pretty regularly having some form of excellent sex, like, it's okay. Sometimes it's going to be mediocre.
There is a wonderful theory around this by my friends Peggy Kleinplatz and Barry McCarthy, who talk about good enough sex.
Yeah.
And that it is not that you have to be having amazing room crashing sex all the time. You have to be having good enough sex, that there has to be some pleasure, something you're getting out of it. And whether that pleasure is physical, emotional, relational, good sleep, it doesn't matter what the reason is, as long as it's good enough on a regular enough basis, hopefully with some great thrown in there along the way, and maybe with some once in a while too.
Right.
As long as the average is good enough, that is the kind of sex that can keep you going.
Yeah, I think that's really important. Also, I think the other thing couples struggle with is sexual boredom, right? Or getting into a routine. So what tips or, things that people can incorporate in terms of novelty or other things to sort of spice up their sex life?
This is a great one. So I think that there's two sides to this. One of which is going back to that idea of good enough sex. Good enough sex is good enough sex. And everybody will fall into, when they are in a relationship, will fall into what we call the sexual script. What is the basic way that you do it, the average way that you do it again and again? And that can be either a time of day of the week, or weeks of the month. What positions do you usually use? How do you usually approach it? And everybody will fall into some form of moderate routine with their sexual script, and it's a tried and true. And the idea that it has to be different every time is also one of those fallacies. Mm-hmm. And so a sexual script is a great thing to have. It's comforting. It's your go-to meal. It's what you reach for, and it keeps you nourished, and it keeps you sustained, and it keeps you going. So first, we want to understand that there's nothing wrong with that. But the flip side is, yes, sometimes you're kind of like, well, that's kind of boring. I'm done eating my go-to home meal. I'm ready to go out for a nice fancy something different. Mm-hmm. And there are so many things that you can do to mix it up. And they range from simply changing the time of day to incorporating some differences of positions, to trying some new approaches. One of the things that I think is a great approach is reapproaching the way you touch your partner, and really taking the time to just touch your partner. Maybe even taking a whole session or 2 sessions where you're not even focused on genital contact, but focused on pleasuring your partner in other ways, and focused on what that feels like to you. This is sort of a variation of what we call sensate focus in sex therapy. And it's a wonderful way to reintroduce yourself to your partner and reintroduce yourself to the feelings that you have with them, and for them to reintroduce themselves to your feelings and how it works. But there's so many things you can do. There is dressing up. There are a variety of toys. You could go and do some role play either at home, or meet out at a dinner and pretend to be on a date, or try a new routine. And the only limit is your imagination. One of the most wonderful things about sexuality is, if we allow ourselves, it is one of the few areas that we are free to play as adults. It is one of the few areas where whatever you want to do, whatever you want to try, however you want to imagine it, whatever make-believe, whatever new construct you want to come up with, it's all fair game as long as your partner is in agreement. And as long as, if you're doing some things that are more exotic, you understand some of the risks. But there's plenty of ways to find the information out there and start engaging and trying things.
So how do you introduce, let's say, a kink? Let's say, first, maybe you can define a kink, but also how do you introduce that to your partner? Because it may be something very novel that you want to try, but you don't know how to really talk about it.
I love this question because I think people do not understand what kinks are. And I think that they don't understand the difference between kinks and fetishes very much at all. It's often used interchangeably. So a fetish is, at its most elemental, when an individual has an object or a part of the body that they really need to be able to experience desire, arousal, sexual satisfaction. And so it's something that's needed. You need to incorporate that in some way. Kink is not that. Kink is a term that refers to wanting to engage in sexual activities that are outside the cultural norm. Mm-hmm. As such, there is no exact definition of kink outside of that, because it is culturally and contextually dependent. What might be outside the sexual norm here and now is not what is outside the sexual norm in another culture or at another time. And it's shifting rapidly. It even here in the United States is very different between different age groups. So we know that younger people are looking a lot at online porn, and one of the things that we're seeing, and I think you're going to have somebody to talk about this in great detail, but that there's been a lot of a rise in the amount of choking behaviors that are being engaged in during sex. This is not considered normal by the older generations here in America, and it's considered very normal by those engaging in it. So by definition, for those engaging in it, it's not a kink. It is part of sexual activity, but yet for the older generations, it's a kink. And so kink really refers to just what is considered outside the sexual norm. So it is a very individual definition.
It can be anything, really. Yeah.
But if you have something that you want to bring in and try, then again, it can be quite awkward because we don't know how to talk about sex. But again, using some of those same principles of, there's something I want to talk to you about. I really love what we're doing, but there's something else I've been thinking about. Again, if you're not comfortable talking face to face, go on a walk, go for a drive. And then you can say, yeah, this is something that's kind of piqued my interest. I've been reading about it, or I've been thinking about it. If you're comfortable sharing your fantasies about it, a good way to bring it up might be, yeah, it's something that, I've thought about. Would you be interested in reading about it with me? Or if you feel braver, would you be interested in trying some of this with me? You can share, perhaps if you found it in erotica or in some porn that you've seen. I'd like to watch this with you because it's something that's been piquing my interest. If you're interested in sharing it, that's one step. If you're interested in engaging, that's another step. Not as in progressive either, just sometimes people want to share that looking at it or thinking about it or talking about it, but don't actually want to engage. And sometimes they want to actually engage and incorporate a new activity. So using some props and tools can be helpful. There are also a few, and I can't think of them off the top of my head, but there are a few online sex compatibility or sexual interest quizzes that you can find. And the gist of them is that they take you through and you list some of the things that you might be interested in trying and some of the things that you've been interested in doing. And your partner does the same, and then it puts it through the website and spits out, oh, these are the ones you're compatible with, and here are some ones to try on the sides, so that you can feel less vulnerable by putting it in and then having it on a piece of paper because you're both doing it at the same time.
And someone else outputting the results for you.
Exactly. So that can be a great way of doing it. Another fun way of doing it is finding one of the sex games that has dice that have a variety of different things to try, and you can just kind of roll the dice, see what comes up, discuss it, try it, see how it goes. It's important to talk about what it is that you want to do. When you're trying something new, you can talk about what are the parameters, what are you hoping to get out of it. You can talk about how you would like to engage. Again, if it's going to be something that involves the potential for some bodily impact or potential harm, you do want to make sure you've done some research behind it to understand how to do it safely and to consent with your partner. Make sure you have safe words. There are great resources on the BDSM community websites that don't necessarily have to be for hardcore BDSM. It's just a wonderful codified way of going through negotiating how you're going to engage sexually. And it can be for any way that you're engaging. But using those parameters and then talking about it afterwards. How was it for you? What did you like about it? What did you get out of it? What was exciting and new? What was not as exciting as you thought it might be? What did you not like? Do you want to do it again? Do you want to incorporate it all the time? So checking in afterwards can be as important.
How do you take it? So say someone gets so this is obviously people don't know how to talk about sex. So I can imagine it takes a lot of courage to bring up, right? To bring up, hey babe, I kind of want to try this kink I read about or saw. And the partner's like, no way. Immediately is like, no. And they're, of course, they're right. They're they're allowed to say no way. But it can be really crushing to then feel like, okay, I can never bring up something like this again. Or being like, man, am I like, is this the end? Because I can't experiment like this with this person and I really want to try this.
Yes, it can feel that way. It can also bring up feelings of, oh, what's wrong with me? And there is nothing wrong with anybody wanting to try anything that is consenting and safe. There's nothing wrong with it. It doesn't mean all your partners will want to do that. I think that this is, again, where those rules of communication can be helpful. It's much more helpful to say, that isn't something I'm interested in. either now or, that isn't something that I really think I'd be interested in at all, rather than making a sweeping statement of no way. These all or nothing statements are hard to hear. They bring up a lot of defensiveness and can impact when you feel vulnerable already. But if you do hear that, then I would recommend saying, okay, well, I hear that you're not interested at all. Could you tell me why? Is there anything around this or near this that you might be interested in? Is there any other thing that you would be open to exploring?
Yeah, I think the big fear is yes, feeling like there's something wrong with you.
Oh, yeah.
Or that person literally saying, what's wrong with you? How could you bring this up? Because there's a lot of narrow-mindedness around sexuality. And so even when the person may be wonderful and perfect in every other way, but this is something where they are like, their reaction is like, how could this person bring this up?
So we have to understand that there's a lot of potential vulnerability on both sides. I'm not excusing any behavior, but what I want to bring up is curiosity and compassion is the way to approach this. And if you can maintain curiosity, if all parties can maintain curiosity and compassion, you're much likely to have better conversation. And when you have somebody who immediately says, no way, no how, it would signal to me, and within the psychological community, we often think, okay, why? Why are they so defensive about it? Because if it wasn't something you're interested in, but you were okay with it, you could be like, no, not my cup of tea. Like, okay, do you want this food that I love? Oh, that's not a food that I really enjoy. No, thank you. As opposed to bringing with it some condemnation of it. And that gets back to this idea of the straight and narrow sexuality. So it could be that the person who is responding in this extremely strenuous manner has preconceived notions about what is acceptable sexual engagement, and that they might not have examined their own understanding of what is good sexual engagement, what is allowable with sexual engagement. They may not have as good a background in understanding that all parties may have differing values and desires, and that it's about meeting in the middle to the extent that you can and honoring your partners, even if you can't meet them. So we want to try to have everybody that's coming into this reach down deep and find some curiosity and some compassion and say, oh, okay, well, I'm hearing you. That sounds interesting. I'm not sure I've ever thought of it that way. So that could change the way that you say no, or it could change how you even think about it. Maybe now, if you have some curiosity about it, you could say, well, I don't know if that's for me. I've never thought about that. I think that I feel that this might not have been how I was taught sex should work, but maybe I could try it, or we could try something. I think that the tendency is for the person who's hearing the no to both self-blame, what's wrong with me, but that's coming from the same place that the person who's saying no so vehemently is saying, well, this isn't right. And we really have to understand that sexuality is so broad-reaching. There is something for everybody. There are more interests and activities than I can even begin to fathom. The internet has exploded. It made it more available. You can't say what is right and wrong. It's what's right and wrong for you.
Yeah, as long as it's safe and consensual, you can you can play.
Yeah.
You can play.
Are you loving the Rena Malik MD podcast? Well, I love each and every one of you, and I'm truly honored that you choose to spend a bit of your day or a bit of your week with me. Did you ever hear the actual story of why I started making content online? Well, when I was a resident, I remember having a patient who had bladder cancer. And in order to treat her bladder cancer, we had to remove it and then reconstruct a new bladder called an Indiana pouch. Now, with this new bladder, she would have to catheterize herself through a stoma or an opening on her abdomen in order to empty her bladder. So after surgery, immediately she did great. She went home and no major issues. But subsequently, over the next couple months, she started getting readmitted over and over again to the intensive care unit. And we were really wondering what was going on. Eventually, we figured out that she didn't truly understand that she now had to catheterize herself to empty her bladder. Just the simplest thing that was so pivotal, she didn't understand that. And it was then that I realized, as a urologist, I could do the perfect surgery. But if my patient didn't understand the consequences of that surgery, then I failed as their doctor. And once I started practice, I realized that I couldn't teach people everything they needed to know in the 15 or 30 minutes I saw them in my office. And that's when I started creating all my Rena Malik MD content to offer free education to people around the world. And I can tell you that it has been truly one of the most rewarding experiences in my life. And in order to keep providing free content, we need your help. If you are getting value out of this podcast or my other content, I encourage you to join our premium membership. As a member, you'll get early access to the audio and video of the podcast completely ad-free, transcripts of all the episodes, and exclusive access to Ask Me Anything episodes that occur once a month. And during those episodes, I answer questions that are asked only by premium members. So join us today at renamalik.supercast.com. Can't wait to see you there.
You brought up how someone could say they found out about XYZ through pornography. And a lot of people in relationships have, not a lot, but I would say there are some people in relationships who have strong feelings about their partner watching pornography in a negative way. Why do people feel insecure about pornography? And what can you do if your partner is saying like, this is not something that's acceptable to me?
This too comes from that straight and narrow understanding of what sexuality is, and is really rooted in not necessarily only within that concept, but rooted in the concept of monogamous heterosexual interactions for the purposes of procreation, where you maintain your sexual activity only within the confines of a relationship, in a monogamous relationship, and you should only want, desire, and interact with your partner and not outside those confines. And in fact, if we think about it, that construct even has left very little room for self-pleasuring activities, so that there are discomfort with the idea of you are in a relationship and you are masturbating or self-pleasuring, and certainly broadens out to the idea that, well, pornography is perhaps even worse because it's with other people, and a lack of recognition that sexuality is elemental to the individual and then is shared within a relationship. But that doesn't negate the individual sexuality, and that attending to your own sexuality is your primary directive. I go back to these food analogies because I feel like food and sex are so common, but the idea being that you would never expect that you're now in a relationship and only your partner is going to feed you, or you'll only ever eat with your partner. You have appetites. You need to attend to yourself. You are responsible for them, and you can share with your partner and enjoy that, but you still need to take care of your own needs and wants. If people are worried about the use of pornography, it needs to be understood that this is a way of your partner experiencing pleasure. And this is not cheating. This is not because they are not interested in you. It's because they want to experience some other kinds of pleasure too. If they're not physically interacting when you have agreed not to physically interact with others, then that's not cheating.
I'm just going to push back, not because I agree with this statement, but I'm sure it will come up, is that if you use that logic in a monogamous relationship that I have to take care of my own sexual appetite, then you could argue that my sexual appetite includes polyamory in a relationship where you have now chosen to be monogamous, or chosen to go outside the relationship and have sex with other people, and use that same argument.
So here is where we get to how do you treat other people with compassion, and what are the agreements? I know that there is the term ethical non-monogamy. I don't love this term because that still is a moral judgment. So from a health practitioner standpoint, I prefer to take the judgment out of it. What is important is disclosed non-monogamy, because you run the risk of hurting somebody. And that is fundamentally not great. The balance here is attending to your own needs and attending to your own wants and desires, while also mitigating the harm that you are doing. Now, you can't always say that you're going to prevent all harm every which way. That doesn't work. It doesn't even work in monogamous relationships. You can't do that. Even friendships don't work that way. Sometimes friends want more or less. As human beings, I think we have a responsibility to mitigate the harm that we're doing. And in this case, when you're engaging sexually with other people, that harm has some real physical consequences. If you are interested in engaging, if you've agreed to a monogamous relationship and now you realize you are interested in engaging with other people, I would really urge for disclosed non-monogamy. Again, this is one of those conversations that's very hard. There are great people, great resources, great books to talk about how to start doing this. Happy to give some of the basics, but it's really important to start having the conversation about what it would mean to you, why you're interested in doing this, what you think it will do to the relationship. If you get a little bit farther, how are you going to navigate this? What are the limits around it? How do you think you would feel about it? But to just go and say, well, yes, I'm attending to my own needs, therefore I am engaging physically with other people, even though I've agreed to be monogamous, really has the potential for harming your partner.
No, I agree. I wanted to make sure we addressed that because I think it comes up. Let's take some of the things we've talked about and say you are in a new first time encounter with a partner. We know, for example, that men tend to orgasm 95% of the time in a first time encounter and women 45% of the time. But talking about sex.
In heterosexual encounters.
In heterosexual, yes, sorry. Let me be clear. In heterosexual encounters, whereas in same-sex encounters, that jumps back up in female encounters. But how can we take some of these communication tips in a situation where you have just potentially met this person and you are now going to have intercourse with them because you are sexually attracted to them, but you also want to communicate your desires and wants and needs or the way that you tend to climax or orgasm?
Here's where I get back to what I really support for pediatric sexual health education, that one of the strong recommendations I make, not a rule, because I really don't like rules, but a strong recommendation is you should never be ready and willing to be engaging with somebody physically if you're not ready and willing to discuss that engagement with them. I think it is such an important concept because if you are at the point where you're going to be engaging physically, that comes with consequences. That comes with potential consequences of physical health, potential consequences of reproduction, depending on the individuals involved. It definitely comes with potential emotional consequences. And not that all of these have to be bad results, but it does have the potential for consequences. So if you are feeling attracted to somebody, want to engage with them physically, you both deserve for yourself to have somebody that's ready and willing to listen to you, which you can find out if you start to bring this up and discuss what your expectations are and where you stand with all of your health needs or health status, what you expect out of the engagement. Going back to that idea of mitigating harm, in some ways can support that mitigation of harm by expressing these.
Yeah, I think that's, in an ideal world, yes. But I think ultimately people, particularly younger people, they don't have fully developed frontal lobes. They still don't know how to have regular conversations, let alone conversations about sex. So I'm sort of thinking about like what are easy maybe scripts they can use or tips that we can offer to allow them to make that a little easier for them.
So it depends what components you're talking about. I think there are a few different scripts. If you are interested in engaging with somebody, it's starting to get a bit hot and heavy, say, hey, I know that this is enjoyable. I'm really enjoying where this is going. I just want to touch base about your expectations of what's going to happen after. Or you can talk about, please always talk about what are we using for protection? Mm-hmm. What are we using for safer sex? I use the term safer sex because we know there is no such thing as safe sex, but what can we use to make it safer? And if somebody is not willing to talk at least about that with you, then you don't want to be in that situation. That is not caring about your safety. That is not caring about you as a person. If you are getting into an encounter, hopefully you've already had that, what are we going to use for safer sex? What are we going to use for protection? Conversation, and you find yourself in a position in which your partner is expecting things that they aren't willing to give back to you, that's a warning sign. At that point, you have to stop and evaluate for yourself, do I want to be a part of this? I guess the first step for that is if they are asking you to do something or you want something, asking for it. And that's so hard because we don't give young adults language to talk about this. We don't give them the anatomy. We don't give them the words and phrases. They pick up all sorts of words and phrases for various different sexual acts, but we should have some that are just codified and easy and make it roll off the tongue, the same way we have words for all other activities in life. And so asking for what you want is your prerogative. It doesn't mean your partner will want to do it or has to do it, but asking for what you want is your prerogative. And guaranteeing your pleasure, safeguarding your pleasure is your right. I think that this is even more important for young female-bodied people to hear because, as you said, we have this orgasm discrepancy, which really comes from this cultural understanding that sex is about pleasuring the penis and guaranteeing the male orgasm without much regard for female pleasure.
Mm-hmm.
And without much understanding of what actually goes into female pleasure.
It's crazy to me. And you brought up the choking thing. And yeah, we talked about that on the podcast with Dr. Herbenik. But it's crazy to me that people are like, yeah, is it okay if I choke you? They can say that, but they can't. It's so difficult to say, hey, I'd like you to pleasure me with XYZ.
I think one of the most difficult things for people to say, and I don't see children in my practice, but I have many relatively young adults. One of the most difficult things to say is, hey, I really need more clitoral stimulation.
I think a lot of people have discomfort with bringing toys in the bedroom. Like I talk about it all the time, but I think that people are like, I tell my patients and they sort of like go like, like they're like, how could I do that? And I just say it's like a tool, just like anything else. But I think what are some things that you found that have made that transition of bringing toys into the bedroom with your partner a little easier?
I think we have to tackle the underlying myth that causes that reaction. So that's what I talk about with people who become a little taken aback when I mention the use of toys. There is, again, that myth of, oh no, you're with your partner, it's just your partner, you come together, you have penis and vagina intercourse, you have simultaneous orgasms, or at least he has an orgasm, and you roll over and go to sleep. And with that, you notice there's no mention of anything else. Mm-hmm. So then there is an innate tendency to think that bringing in other devices means you are inadequate in performing that script.
Yeah.
And we have to address that and really debunk this idea that there is no inadequacy, that this is all fair game, and that there is only the possibility for more pleasure. And that these are just tools to enhance pleasure. And that toys, I think, here is where we have the toxic masculinity side of the patriarchal myth. I hear more from young men, oh, no, my partner wants a toy. No, I'm not satisfying her. Oh, why can I not do it? That this is not about you. It's not about your body parts. It's not about the size of your organs or genitalia. It's about wanting different kinds of stimulation or multiple types of stimulation at the same time. And it shouldn't matter what it is. If your partner's feeling satisfied, they're happy to be with you and happy to play and feel satisfied. It's not just young men. It is young women, young men, all genders can have some insecurity around it. But debunking the idea that it has to be those body parts, and therefore really explaining that it's not an inadequacy. It is not pointing out an inadequacy. It is not to fill a void of an inadequacy to have toys and bring them into the bedroom.
Let's switch gears a little bit. Let's talk about orgasms. Let's talk about how people can use their mind and their experience to obtain better orgasms.
I love this topic. This is something that is so key in my practice that we talk about. So perversely, I want to put this out there right away, focusing on an orgasm is the worst thing you can do for the possibility of having an orgasm or to the quality of your orgasm. Orgasm is not the end game. That is really important to understand. Pleasure is the end game in sex. That may or may not include orgasm. It may or may not be available to you at any time. But we very much, again, culturally focus on orgasm as the end of sex or as the ultimate pleasure. And I'm not going to lie, orgasm is great. It can be the most pleasurable part. Mm-hmm. For many people, it is the most pleasurable part. But again, the focus on orgasm versus the focus on pleasure is the death knell to the quality or perhaps even the possibility of orgasm. So what people can do instead to really enhance is they first have to understand the physiology. And they have to understand that to be in the right space to even have the availability of orgasm, but certainly to enhance orgasm, they have to understand the autonomic nervous system. So I know you know what it is, but I like to explain it to people as the autonomic nervous system is two states. One is the parasympathetic nervous system, which I call the stream and chill state. And it's when you can sit back, you relax, you're eating your popcorn and maybe having a little nookie. And the other is the sympathetic state, or the fight, flight, or freeze and fawn state, or essentially the lion is after you state. And to have full arousal, you need to have more of a parasympathetic state. You need to be in that relaxed space. You need to just be chilling out. And that requires not being in that sympathetic state. It's not that they are an on and off switch. It's not one or the other. They work as sort of two dimmer switches. And when you adjust them simultaneously, you can see which state you are in. But you really want to lean more towards that parasympathetic relaxed state. And this does not happen if you're busy being worried about orgasm. If you're checking in with yourself, oh no, am I there yet? Am I there yet? Am I going to have an orgasm? Okay. This is anxiety. This is essentially that there is a threat to your pleasure, a threat to your health, that you're not going to have that orgasm, which revs you up, which is counterproductive to the arousal to get you there. So instead, we as sex therapists and in the psychological community really rely on using more focus on sensation. You want to focus more on the bodily sensation. You want to be more mindful, and you want to focus on those sensations. We use a technique called sensate focus to help people learn how to do this, and often use mindfulness as well. There's a lot of great evidence about mindfulness. And the best way to focus and enhance your pleasure is to focus on the sensations. Here's again where communication comes in, because you want to both focus on your sensations and be able to communicate to your partner what will give you more good, pleasurable sensations. The more you focus and learn what are good sensations, the more you hang on to those, the quieter your brain becomes, the less of that sympathetic state happens, the more you enhance that parasympathetic state, the more you enhance that pleasure, the greater the pleasure you have, the more likely you are to have satisfying orgasms.
I think that's so important. There's always like these movies or things where they're like, oh, baby, come for me, right? Or like have an orgasm for me, which actually adds more stress, right? Because if you're not primed and ready to go at the moment your partner is asking for it, you're not going to come. You're not going to orgasm, because that's just stressful.
It can be. For most people, it really is. Not everybody. Some people really enjoy that component of pressure, but for most people, that is extremely stressful and counterproductive.
Yeah. Yeah, no, I think it's really important. I think there's a lot of discussion about how women are multi-orgasmic, and that can also lead to sort of, because women can feel inadequate if they're not multi-orgasmic, or like if they're not having orgasms, even just one versus multiple. What are your thoughts or tips there?
Again, not focusing on orgasm. I think that this gets back to that cultural script of sex is about mainly penis and vagina, but certainly about heading straight to the orgasm. And now that we've started to think about female pleasure as a culture and noticed that women don't have as long a refractory period as men, they have the potential to be multi-orgasmic, that became, okay, you need to be. But that's not true. You need to have pleasure. You need to be safeguarding your pleasure out of the encounter. And that comes back to the more you focus on it, the less likely it is to happen. But it's not a problem if you're not having orgasms, if you are having pleasure. And it is not a problem if you're only having one orgasm, if it is pleasurable to you. Mm-hmm. Nor is it a problem if you're having multiple orgasms, as long as it's pleasurable to you. But to feel that you have to might not be as pleasurable innately. So we want to take the focus away from orgasm for all genders. It just really needs to not be the focus, and for all body types. But I get many women in my practice who come in and are feeling inadequate because they only reach orgasm occasionally, or they are not multi-orgasmic. And we really need to understand what is the incorporated understanding of what myths around sexuality you have that you are comparing yourself to, and provide real education about the fact that this is not true. Not all women are multi-orgasmic, certainly not all of the time. And there is a percentage of women that don't have orgasm at all. It doesn't mean that they don't have satisfying or can't have satisfying sexual lives. When you understand what is more of the reality, that can help you feel better. It's a destigmatization through normalization and through education. And that alone can take some of that pressure off and leave you better able to access your pleasure by being less anxious, being more in that chill state.
Yeah. I want to talk about, because I know this is an area of interest for you, but about how to talk to kids about sex.
I love this area. I found myself kind of falling into this area. I have children and thinking about what I would want them to know. And also because everybody that I see in my practice, really a major component of what goes into the dysfunction, even when I just see them for a consult and we realize it's biological and I send them off to have some biological treatment or assessment and treatment, the lack of education has so hindered them. It's hindered them from seeking help, or it's hindered them from understanding that it's biological, and therefore they end up with me feeling something's wrong with them on the psychological level, or whatever is going on psychologically or sexually could so easily have been prevented, or mainly prevented at least, by having had good access to education. So for all of these reasons, it really became so clear to me that we are underperforming when we are not providing good sexual health education for children. And it's been fascinating to be in this space because I think that so many adults think that means that I'm saying, therefore, we should go into kindergarten and talk to them about how to engage sexually, what is intercourse, what is kink, and that is not it at all. What good sexual health education is for children is providing foundations, age-appropriate, repeated education that provides foundations. So it starts with giving them the names for their body parts, talking about what their body means to them, talking about how they interact physically with things like, how does it feel when you're sad and you get a hug from mommy or daddy? It feels good. Hugs can feel good. But you have times where you don't want a hug, and that's okay too. You're allowed to say no. That's laying the foundations for consent, for bodily autonomy, for physical pleasure. Knowing their anatomy gives them the words, and talking about it in a very non-stigmatized fashion gives them the understanding that it is okay to talk about that, lays the foundation for being able to communicate more effectively later. Plus, when caretakers engage in this way and begin talking and building on these sexual health concepts, and when kids get them through other sources too, hopefully through school, though we know that that's a little dismal, but also hopefully through their health care practitioners, then it normalizes talking about it, normalizes that this is part of life, and opens lines of communication so that if they encounter problems, they're more likely to come and fix them early on. Mm-hmm. And there is abundant evidence that providing this layered, comprehensive sex-positive education helps on so many levels it blows my mind. It helps by preventing kids from being at risk of abuse. When they have words for their parts, I heard one horrible story that I didn't verify it. I don't know. I truly hope it's not true. But one horrible story of a young girl who reported to her teacher that her uncle kept touching her muffins. And this went on for a few weeks before her teacher realized that her muffin was her word for her vulva. We need accurate language. That could have been stopped sooner if we had accurate language.
I've heard similar stories, not that exact one, but again, when you don't have the terms and you come and try to explain what's going on, if you can't explain it, it could be misconstrued.
Oh, and it just drives me crazy. I want to protect these kids and give them the possibility of health and safety. The way to do it is start with young children with those foundational topics and then build in an age-appropriate way. And so with middle kids, you can start talking about, often quite young kids will have siblings on the way. they either have a sibling on the way or they are a younger sibling or their friends' parents will have siblings. So they'll want to know, where do babies come from? Giving concrete explanations of where babies grow, of how babies go through the vagina to be born, or you can say sometimes they don't come that way. And giving explanations of how families are made sometimes doesn't involve that either can be very helpful. They want to know about their own bodies and they notice the difference in other bodies. Explaining the difference and saying that, everybody has a different body. Everybody shares parts, just like everybody has a face, everybody has a nose, but they all look different. They also have other parts. Everybody has elbows, but they look different. Everybody has genitals, but they all look different. And then providing the names for the parts of the genitals. Again, I feel this is particularly important for female-bodied people because so often they don't have words and they can't see their genitals the same way. Offering a mirror, naming the parts can be very helpful for them. Very destigmatizing, very non-shaming. And then as they get older, continuing to talk about relationships, continuing to provide education about physiological processes. One of the tenets of good, comprehensive, sex-positive sexual health education is approaching each area of development in advance of the time frame, so that you are starting to provide the information before the kids start to have the changes or start to engage in behaviors, so that they can hear it and start to understand what their responses might be when this happens to them, and have some options for how to respond rather than be surprised, be scared. Mm-hmm. And ultimately, you want to be talking about puberty before kids hit puberty. And we know that for girls, this happens around ages 8, 9. It's slightly later for boys, but you want to start talking about it in advance. Otherwise, kids get scared, and otherwise they're desperate for information. And then they're turning, particularly around sexuality, they'll turn to the internet. They'll get poor information, misinformation, sometimes even disinformation from their friends or from the internet. And one of the things I see commonly is people coming into me with this idea of, sex is whatever they've seen in porn. Porn is great. Porn can be wonderful. But that's rather like having kids sit down and, if you shielded them from ever driving, you never let them in a car, and you closed their eyes and told them to look away when cars were driving past. And then when they're 16 years old, you sit down and let them play Grand Theft Auto with the racing cars going up the walls and crashing, and then it resets. And then once they had played a few hours of that, you toss them the keys. Grand Theft Auto is for entertainment purposes. This is not education. No, you start kids in cars. You tell them what's safe. You tell them what they need to look for. You start them slowly driving. You make sure they're safe. You just shepherd them along the way, step by step, until you finally let them go out on their own. And engaging sexually needs to be that way too. Not that you have to be sitting by their side as they engage, but to provide the information so that they have that information in advance. And it just is really amazing to me that ultimately comprehensive sex-positive education, preferably provided by caretakers, it takes a village, right? So preferably provided by caretakers, by educational systems, by healthcare systems, results in such a myriad of positive outcomes. It results in later onset of sexual engagement. Even for early kids, as we said, it results in better safety, reduced rates of child sexual abuse. So these kids are safer. That results in later on, speaking of abuse, it results in later reduced incidents of intimate partner violence and reduced incidents of domestic violence. And so you're talking about decreased victimization across a lifetime. It also results in later onset of sexual activity, as we said, in increased use of protection with first sexual encounter, decreased risk of teen pregnancy and unwanted pregnancy, decreased risk of STI transmission. It results in increased satisfaction with first sexual encounter and seemingly with ongoing sexual encounters, increased satisfaction with your sex life. The results there are not as robust because the research just hasn't been robust. It's hard to do across the lifetime, but there is some interesting evidence there. It also has more profound and far-reaching. It results in better communication skills, better relational skills, increased empathy, increased understanding and tolerance of difference, whether that is racial or sexual and gendered minority difference. It results in increased compassion and better ability to have conflict resolution because you have increased skills of talking about these difficult topics with good comprehensive sexual health education. You're modeling that you can talk about these topics. And I like to think there is very little evidence. I haven't found any yet because we haven't done these multi-generational studies, but it would seem to me that when you provide this comprehensive sexual health education, with all of the results, we do know that these are the things that often go into increasing the likelihood of having sexual dysfunction, having relational dysfunction. So you're going to have improved sexual function, relational dysfunction, which we know is correlated with better mental and physical health outcomes and better quality of life. But I also like to think that therefore you'd have a whole generation, once you raise these children, who would be less unable to provide this for their own children, and we could start to break this cycle.
Yeah.
And just increase health. I mean, the potential far-reaching benefits blow my mind.
It's amazing. And I think everyone can agree that you may not agree with everything, but you can agree that you want them to be safer. You want them to have less abuse and less partner abuse, right? Like those three things, I don't think anyone could argue on. Like you want that for your kids. Everything else, you can argue whatever you want. But those are like non-negotiables for me as a parent. And I would think that would be reason enough.
Yeah. And it is important to add, I know they can hear some of the pushback potentially. Many of the arguments out there are, oh no, but we don't agree with having sex before marriage in our family, or our particular culture or religious dictates our XYZ. But it's so important to understand that this education does not negate anybody's values, any religious values, any cultural values. It can be provided as this is factual information, yet our family values, our religious values, our culture values say that this is the way that you should conduct yourself. You are only safeguarding. You don't tell your kids not to wear a seatbelt because you don't want to deal with them getting in an accident. You wear a seatbelt to prevent the problem. Yeah. And so this is information that is just prevention in case something happens. And with all those benefits, yes.
Yeah. I share very often. I talk to my sons, or at least my older son so far, about sex, about the potential for coming across erotic films or things like that. And it's uncomfortable for me. And I talk about sex for a living, right? And it's still uncomfortable for me. And it's going to be uncomfortable for everyone because we weren't given the scripts. But this is life-saving information. And it's really valuable. And you just have to sort of work at it slow. It doesn't have to be all in one sitting. It doesn't have to be.
It's better not in one
sitting. But like people will think, I have to sit down and have the talk. Right. I think that's wrong. Like that's not the way that we should be approaching this. This is something that you give in small doses over periods of time. One, you get more comfortable with it and your child gets more comfortable with it. And they start feeling, this is something I can talk about regularly.
It's exactly it. You're modeling that you can talk about it regularly. Children do not have the attention span to absorb all of sex ed in one talk. Nobody wants to sit down and talk that long about it. Well, except maybe for you and me.
Yeah.
But nobody wants to listen to that much. And it is, you can't provide all of that because you want to provide it at each education at each developmental stage, and you need to deliver it differently. They have different concerns. But it's also that you need to understand that by repeatedly talking about it, you're normalizing it. And there was something else I was going to say, but I've totally forgotten.
That's okay. I mean, I think a good, at least, and these are just things that have worked for me, not based on any evidence, but if they see something on a TV show or a movie, I sort of watch their reaction and then I'll be like, do you have questions for me? Like, did something confuse you about that? And then I let them say, like, you can ask me anything, right? I'm not going to react in a negative way. I will always tell you an answer and I will always tell you the truth. And I will, of course, couch that in the appropriate language and the appropriate way to discuss it based on their age. But I've sort of made that a thing. Like you can always ask me about something your friends told you or said, or something you saw in a movie, or something you're curious about. And that's worked in our home, in our relationship with my son. And so I think that's a good way to go about it, because sometimes you may say something, but they are like, literally haven't even been thinking about it. So they don't really know how to connect the dots.
Right. I think that brings up a really important point, and it brings me back to what I was going to say that I remembered. But there's as much as you can say, and I feel relatively confident saying I'll always answer your questions. Many people don't feel confident because they don't have the information that we do. So one of the coaching tips that I provide, because one of the things I do in my practice is offer consultation for parents to try to help them get set up and be able and ready to do this, is that you don't have to be comfortable doing it. And if you're not, you can own that. If you start young, one, they may or may not notice that you're not comfortable, and you will be comfortable by the time they're able to notice, or at least more comfortable. But two, even if you're starting later, it's not too late. And even if you're uncomfortable, you can just own it. You can say, hey, look, I am really not comfortable talking about this because I wasn't taught to talk about this. But I believe that this information is really important for your health, for your safety, for your quality of life. And so therefore, even though I'm not comfortable with it, I'm going to talk about it to you anyway, and we'll learn how to get comfortable together.
Yeah.
And that you're then not only providing the information, but you're also modeling how to approach a difficult topic and what to do when something is important, and that you really love them and value them, and that you're willing to work through your own difficulties around it. And the other point to what you were saying is I also recommend buying a bunch of age-appropriate books. There are some really great books out there for almost every age level, and we're working on one for the very young kids. But there are some really great books, and you can talk to your kids and then say, hey, I have some books. They may or may not be willing to pick them up. When they're younger, you can always read books with them, but when they're in middle school and a little older, you just let them know that you have books, and you leave them out. And you let them know, here are some books. They have a lot of great information. And if you have any questions, I'm here to talk about them with you. So that's a great way if you are not as knowledgeable or want to bring up some things but aren't as comfortable, to really introduce the information into the family environment.
That's great. Before we finish up, I just want to make sure that we cover what are reasons to see a sex therapist, because I think a lot of people think it has to be a relationship issue, and it's not. I will often send patients to sex therapy because they're struggling, and they may even have an organic reason or a biologic reason for sexual dysfunction, but that often affects your thoughts around sex, or your thoughts around like performing as so to speak, or being involved in sexual relationships, and that can cause more injury to that already,
It builds.
It causes more anxiety, more stress, and then it makes it even harder to potentially, for example, for men with erectile dysfunction, they will often develop anxiety, stress around performance, which I don't love that word, but it's sort of what people know it is. And so they will get more anxiety. And even when you can overcome the organic component or the biologic component, because there's so much stress, that you will not be able to with traditional measures. So maybe you can go over some other reasons why people should come see you.
So it is absolutely true. There is no separation between the psychological and the biological. They are absolutely completely intertwined. I was recently saying one of my pet peeves is this idea of it's all in your head. One, of course it's in your head. Your head is part of your body, and your head is where you process all of the sensation and process how you feel about it and register what it means in your life. So that, one, shouldn't be a bad thing. But two, your head is part of your body, and they are inseparable. What happens in your head affects your body. What happens in your body affects your head. They are all connected. And what you said is completely right. The most important organ of sexuality is the brain. Mm-hmm. I often remind people of that. I also like to remind them that actually the largest sexual organ is your skin, because that's just the largest organ there is, and you get all your touch. But the most important one is your brain. And there should be no hesitation in seeking sex therapy. If you're not satisfied, you want to be more satisfied. If you're having issues, even as you said, if you say, oh, well, somebody said it's a biological issue, and so I should just be able to take a pill, that is often not it. Mm-hmm. There are, unfortunately, even in medical education, there is a dearth of sexual health education. And so very many practitioners know about the medications, but don't understand the complexity of the biopsychosocial underpinnings to sexual engagement and to healthy sexual lives. And so they will miss that, oh, maybe you also have relational problems, or it is a biological underpinning, but now it's caused some problems and rifts in the relationship or in your own mind and anxiety, and that does feed back. So there should be no hesitation for seeking a sex therapist for anything related to, and it's not always the same therapist that can cover all of these topics, but there are sex therapists who specialize in all of these areas. Anything related to questioning your sex, anything related to questioning your gender, anything related to problems functioning sexually, anything related to pain, anything related to how sex is impacting your relationships. There is somebody out there for you to see, and there is help available. It should be as commonplace as going to call your physician when you have an issue. It just needs to be. I know there are not enough sex therapists. I know some places have a dearth of sex therapists, and access is really a big issue. But we do have teletherapy. Mm-hmm. There is increasing amounts of access across different lower volume sex therapy areas. And I would love to see more. I would really encourage everybody and anybody who could possibly find one. If you have an issue, go see a sex therapist.
It is so valuable. And it's not all what you see in the movies, like, oh, you're going to come in with your partner and you're going to have sex and they're going to watch you and tell you what you're doing wrong or right.
That is exactly the opposite of it.
Like some people really think that. And so I think it's important to debunk that myth.
I really often start by saying, you need to know what sex therapy is not. Sex therapy is not you coming in and having sex. Sex therapy is a talk therapy. You come in on your own or with your partners and you talk about what your problem is, and then your therapist will say, okay, I think that some of this might be an issue, some of it might not be. Comes up with a treatment plan, and then works with you progressively, particularly if it's a sexual function issue, works with you progressively to outline some behavioral activities, understand your thoughts around them. You go home and engage in these behaviors, which are usually sensual behaviors for quite a long time before they become sexual behaviors. You're not even going to be doing sex immediately. In fact, one of the tenets of sex therapy is usually to cut sex off the board. You just take it off the board for a while because it's a problem. You want to go back and fix what is going on and start fresh and work your way back into a healthy engagement. So there is no engaging in the office. There's not even much engagement in sex to begin with at home, particularly if it's a sexual function issue. And then you come back and you report to your therapist what it was like. Usually the therapist will have you take notes. You take some notes on what you liked, what you didn't like, how it felt to you, what your thoughts were around it, and you talk about all of that and you move on to the next step.
And sex therapists realize this is hard for you. They realize talking about sex is hard for you. They are skilled and qualified and ready to help guide you through that conversation. So you don't have to come in and be like verbal diarrhea about sex because that feels intimidating. So they work with you.
Or if you do have verbal diarrhea because it feels intimidating, we are ready and able to receive that and help you feel more regulated. And you don't have to worry about the language you use. As I tell my patients, I don't care what language you use. I've heard almost all of it. And if I haven't heard it, then I really want to know it. Yeah. I want to know what other language there is out there. Yeah. So whatever language you're comfortable with, you can use however you want to explain it in whatever way.
Absolutely. So we end the podcast with a few questions we ask everybody. The first one is, what is something that you wish you knew earlier that you know now?
I wish that I had known that this area of study existed really even sooner than I did. I wish that I had known that how absolutely elemental sexuality is to the human experience, to health and health behaviors. I wish that the stigma hadn't caused me to arrive at it in a relatively late, though albeit much earlier fashion than many arrive at it.
Yeah.
I wish that had just been part of the education so that I had known it always.
Yeah, and you did mention how little sexual education we get in even medical school, and I will attest to that. And we went to the same medical school, NYU, right? But either way, so doctors are not getting the education. So when you see your primary care doctor and they wave their hands and they don't know what to do, it's because they weren't educated. And give them the benefit of the doubt. They're not trying to hurt you. They're not trying to be bad. They just don't know.
That is a whole nother topic. We talk about some other point, how to advocate for yourself or deal with your practitioners who don't know how to approach sex. But that is another area I work in.
Yeah.
Like supporting more sexual health education within
I know
health
there's so many
education.
things I want to do in life.
Yeah.
What's a non-negotiable, something you have to do every day? It doesn't have to relate to our topic, obviously.
What springs to mind is some form of exercise or movement, but what is an absolute non-negotiable is I need to check in with my kids and I need to check in with my husband. These relationships are precious to me. These people are precious to me, and it is absolutely non-negotiable that I at least have time to check in with them and tell them how much I love them.
And it shouldn't be that hard to do, right? Like
No.
we should always have a few minutes for our loved ones.
Yeah.
What is a life hack or health hack you would share?
If I only had one life hack or health hack to share, if I only could ever give one prescription forevermore, and I am a sex therapist, but a physician, so I can prescribe many drugs, but if I could only prescribe one, it would be exercise. Some form of exercise. It doesn't have to be running marathons, but some form of exercise multiple times a week is the best prescription for good life, good sex, good health.
Absolutely. And what's one thing, and I know there are many, that you could do to change, that you wish would happen that would change the world?
More sex education.
Amen to that. All right. Well, thank you so much. Let people know where they can find you.
You can find me on my website, which is psychandsexmd.com. I also am on social media under @psychandsexmd, and that is all sexual health education all the time, along with a few observations about the realm of sexuality and where we stand, but usually couched in educational format.
That's great. Well, thank you so much.
Thank you. I so enjoyed being here.
Thanks so much for listening to today's episode of the Rena Malik MD podcast. If you are enjoying this content, a zero cost-free way to support this podcast is by going on YouTube and subscribing to our channel or following us on your favorite podcast platform and leaving us a rating or review. If you want to learn more about me, feel free to follow me on social media at Rena Malik MD on most social media platforms. And as always, remember to take care of yourself because you're worth it.